Good morning, all our colleagues. Thank you, Dr. Mohammed Hunaim and Playmat and Mohammed Noshi for the introduction. And thank you for my colleague, Emirate Internal Medicine Society, for inviting me to be in the scientific committee, and congratulate them for this excellent scientific program. So we know the GLP1 therapy, for the last few years, the fundamental role in the management of patients with diabetes, with obesity, and for cardiovascular protection. But in the coming 15 minutes, I will spot on another two interesting potential role of GLP1 therapy apart from diabetes and obesity. This is the campus of our university, the Gulf Medical University, and Thombe University Hospital, where I practice since 2004. This is my disclosure, and I have no disclosure for this presentation. So the first, I will focus on the therapeutic perspective of GLP-1 receptor agonist in bronchial asthma. We know bronchial asthma is a chronic inflammatory disease involving multiple mediators and cytokine, and the prevalence of diabetes in the UAE and worldwide is from 10% globally up to 16% to 20% in the all Gulf region. And an estimated 1.3 million UAE residents, around 14% of the population, suffer from bronchial asthma. Abu Dhabi Authority announced the creation of a new registry to improve health care outcome and the treatment of a chronic condition like diabetes and asthma. So what links diabetes to asthma? There is an increased risk of asthma among patients with diabetes and vice versa. Having diabetes and poor glycemic control is associated with an increased rate of asthma exacerbation and increased mortality among those hospitalized for asthma exacerbation. Obesity also is a risk factor for the development of asthma. And the glucagon like receptor agonist, we know as an enteropancreatic hormone-based treatment, first approved in 2005 for type 2 diabetes, and they are now commonly prescribed globally and the UAE for weight loss and reduction of atherosclerotic cardiovascular disease risk in patients with and without type 2 diabetes. What characterized the bronchial asthma exacerbation that despite the asthma medication have shown significant therapeutic benefit despite the aggressive therapy, the good adherence, good inhaler technique, some patients continue to have exacerbation. And exacerbation lead to loss of lung function, exposure to systemic corticosteroid therapy, effect on the quality of life, and even mortality. What link the asthma and GLP-1? There is large number of GLP-1 receptor in the lung, even compared with other organ. And the study have shown evidence of reduced exacerbation in asthmatic treated with GLP-1 receptor agonists. While weight loss may affect the lung mechanics, but evidence of inflammatory changes has been revealed that could explain this relationship. So we know that in asthma there is the potential effect on inflammatory cytokine, which is play a role in the pathogenesis. What GLP-1 do is decrease the mucus production and also decrease all the interleukin, which is a pro-inflammatory, and with this will lead to improve the airway responsiveness, and this is shown in many study data. We know that losing weight will have an impact on the lung mechanics and the parameters of the functional reserve capacity, the total lung volume, and also the autosaturation, but also there is direct effect of the GLP-1 receptor agonist in form of decreasing fibrosis, decreases mucus secretion, increase bronchodilation, and decrease inflammation and oxidative stress. GLP-1 appear in much higher concentration with the bronchoalveolar fluid compared with the serum, which may indicate a specific function in the lung. So its rule is produced, maybe it is produced by the pulmonary neuroendocrine cell, as GLP-1 is present in a human bronchoalveolar lavage fluid sample. So GLP-1 is known to modulate inflammation, and the nuclear factor kappa B is an important transcription factor that play a key role in inflammatory process by regulating the cytokine activation within the airway, and the GLP-1 analog can inhibit the activation of the nuclear factor kappa B. In addition, in type 2 diabetes, GLP-1 analog have been shown to reduce the serum level of tumor necrosis factor, CRP, and the NF-kappa B through the modulation of the protein kinase A-dependent signaling pathway. And the lipopolysaccharide-induced macrophage activation was attenuated through the same pathway, which led to reduction in the surface expression of many markers, the CD11B and CD69, and the production of interleukin 4, 8, 13 in the eosinophil. So this is the same research team also, they found the GLP-1 receptor expression on eosinophil in allergic asthmatic cohort compared with the non-asthmatic patient cohort. And the Th2 cytokine production and markers of eosinophil activation were suppressed with the use of GLP-1 analog. So this is probably a complicated slide, but just to say that the main cytokine profile attenuated by the GLP-1, that it is act on the pro-inflammatory cytokine, which is provoke the exacerbation of asthma and enhance the anti-inflammatory cytokine. So what is the mechanism? Decreased body mass index, this is one. Decrease airway inflammation, decrease mucus secretion, decrease type 2 inflammatory signaling, decrease the interleukin 4, 5, 13, and 33 secretion, decrease mast cell activity, and increase surfactant production, and increase the smooth muscle relaxation. So to conclude this first part of my presentation, GLP-1 constitute a promising opportunity for the treatment of respiratory disorder, especially if our patients are also diabetic and obese. As research progresses, this agent could become more central in the treatment of respiratory disease. And due to their multifactorial beneficial property, this agent appears to be viable candidate for the treatment of variety of respiratory conditions in addition to the well-established lung-directed therapy. So I think we bring a fruitful outline of the potential clinical utility of managing bronchial asthma patients with diabetes and obesity with the GLP-1 therapy. The second interesting aspect of the potential role of GLP-1 is just released recently in August, the therapeutic perspective of GLP-1 therapy in metabolic, associated steatohepatitis. That in 15 of August 2015, semaglutide 2.4 milligram received the accelerated approval from the US FDA for the treatment of metabolic associated steatohepatitis in adults with moderate to advanced fibrosis. This is the third indication overall for semaglutide, which is already approved for obesity and the cardiovascular risk reduction. This is coming from the phase 3 Essence trial, semaglutide in metabolic dysfunction associated steatohepatitis, published last December in the gastroenterology and hepatology. And the summary of this, that giving semaglutide 2.4 to those patients improved liver histology. 63% of patients treated with semaglutide achieved resolution of steatohepatitis compared to 34 on a placebo. And the liver fibrosis improvement, 37% of patients show improvement in liver fibrosis versus 22 on a placebo. High treatment adherence, up to 84% of the patient maintained the target dose of 2.4 milligram until 72 weeks. And the FDA granted an accelerated approval, so it is approved for adults with non-cirrhotic MASH with moderate to advanced liver fibrosis in conjugation with the reduced calorie diet and increased physical activity, which is fundamental in the management of MASH. What is the potential impact of this in our locality? The MASH affects approximately 1 in 20 people in the US. And the problem in the UAE is a growing concern, with the country facing a significant burden of disease associated with NAFLD, up to 32%, and MASH. About 60% of patients with NAFLD present in the Middle East are estimated to have MASH with a projected increase. What is the economic burden? The lifetime discount direct costs associated with NASH and advanced fibrosis in the UAE are estimated to be around 1.6 billion through 2030. The UAE government and healthcare organizations are taking steps to raise awareness about NASH and address the growing burden of disease. And a regional coalition, including the Emirate Gastroenterology and Hepatology Society, has signed a call of action to raise awareness about NASH and to promote early detection and treatment. And the approval of semaglutide could potentially alter the natural disease progression towards cirrhosis, liver cancer, and the transplantation. And this is not surprisingly that now GLP1 therapy on the top on all the trials for MASH target by number of the pipeline drugs. And probably we will hear many of the players in the coming year. The GLP1 based agent in development for MASH and obesity, and they found that combining GLP1 with the glucagon will have marked impact on this. So probably we will face the combination in the near future. What is the emerging trend? The last two slides. What is the future perspective for the GLP1 therapy? Expanded the therapeutic indication, exploring its treatment apart from the diabetes and weight loss, the cardiovascular disease, and the neurodegenerative disease in Alzheimer and dementia, and broaden the scope could make this medication integral to the multiple area of medicine. A growth of the longer-acting formulation, that advancement in the peptide engineering aim to create formulation that require less frequent dosing, such as biweekly or monthly injection. And this improvement could enhance the patient adherence and convenience, make treatment plan more manageable. And personalized and biomarker-guided therapy, we know that not all our patients are responding the same for the GLP-1. So with the advent of precision medicine, clinicians are increasingly able to tailor the GLP-1 receptor agonist therapy based on genetic, metabolic, or biomarker profile. And this approach promises optimize efficacy and minimize the side effect of individual patients. Combination therapy will come in with the glucagon as well as with SGLT2 inhibitor, and this combination aims to enhance the therapeutic outcomes for complex metabolic condition. And innovation through digital health integration, including the mobile app and wearable device for better adherence and follow-up. This is the reference, and thank you very much, and we can communicate.